Good afternoon, and welcome to everybody who's participating in what's going to be a very important conversation. Here in the City Attorney's Office, we call these discussions Thrive. We're trying to work with senior citizens across the city of Los Angeles to assure that in these years where we're getting older in a way that is full of joy and fulfilling and rewarding. And we're trying to talk to experts about the ways that they suggest all of us can thrive since we're all getting older. So as we begin today, I want to say to our friends at High Village, thank you so much for joining us. High Village, of course, is this wonderful team comprised of members of Temple Isaiah and Temple Emmanuel of Beverly Hills, who've come together to assure that senior citizens in our community have a place to which they can go to be part of a community, to participate with each other as they learn together, and indeed as they thrive together. Because as we get older, we all need communities of friends to be part of what is this very rewarding life. Now, there are about 65 members of High Village who are participating today, which is just wonderful. I want to thank Barbara Meltzer and Talia Carew for helping produce this event, which is being seen both virtually through Zoom and live on Channel 35 LA Cityview. And I want to thank our LA Cityview 35 friends for always being not only so hospitable, but being so focused on assuring that our community is educated about the issues that matter the most. Now, we're going to dive right into this presentation. I'm going to say at the outset, here are some ground rules. I'm going to introduce our panelists, who are just marvelous, as you will see and as you will hear. I'm going to ask them questions. I'm going to encourage them to respond to each other and not just to me, because we've seen as we do these Thrive presentations that this team likes to listen to each other and respond in real time. As they do that, we'll engage in about a 40-minute discussion, I think thereabouts, and then we'll have an opportunity for questions. Now, if you are a High Village member who has access to a computer and you're watching this through Zoom, just put your question in the chat box. You'll be silenced during the discussion. Your cameras will be muted, but you can put the question in the chat box, and then I'll be sure to put your questions to our panelists. If you're watching this live on Channel 35, you won't have that opportunity, but you can feel free to email a friend in High Village and ask them to ask your question for you, and that's how we'll circumvent that challenge. All right, so let's get right to it. What a great panel we have for you this afternoon. We have Dr. Dan Stone. Dan, who has been so generous, all our panelists have been so generous with their time as we've been doing these presentations across the city of Los Angeles. He is an internationally recognized geriatric specialist with the Cedars-Sinai Medical Group. He's a past president of both the LA County Medical Association District 7 and the LA Society of Internal Medicine. And as you will hear in a moment from now, Dan really knows his stuff when it comes to seniors, health, and how to thrive as we get older. Christina Toussan. Christina is a terrific member of our staff here in the City Attorney's Office. I am so proud that Christina chose to join our office a few years ago. She's a deputy city attorney who oversees our consumer protection unit. She's been working in this realm for about 20 years. She's prosecuted complex and criminal consumer protection cases on behalf of our office, the California Department of Justice, and the Federal Trade Commission. And her work, Christina's work, has led to settlements and judgments in excess of $640 million, which is more than she makes in a year working for us. Then we have James Darren. James Darren signed with Columbia Pictures 65 years ago. It is hard to believe. And he is still going strong. Once we're able to have live performances again, you're going to be able to see James touring, including headlining in Las Vegas again. I know that people who go to Las Vegas are going to be thrilled to be able to see you live there. James Darren, what a national treasure you are, and how grateful we are that you're joining us today. Okay, so with our introductions, it's time to start to ask some questions. And I'm going to turn first to Dr. Dan Stone. Dan, I know that for every single person participating today, the question on their minds is the vaccine. When are they going to get it? Talk to me about its health impacts and so on. So is there something about the vaccine itself or the vaccination process that you think that our viewers don't know, but they should?
Well, thanks, thanks, Mike. First, I'd like to express my appreciation to you for your public spiritedness in putting together such outstanding programs. And I feel honored to be here with Jimmy and Christina, who were such outstanding panelists. And I've always been impressed in the past by all the comments. And also a pleasure as a congregant of Temple Isaiah to be here. Yeah, I would say if there was one item that I think is not well understood or well enough understood, it's that strangely, and I would have said counterintuitively, in the case of most infections, COVID-19, the immunity through natural infection is not as reliable as the immunity through vaccination. Usually that's not the case with most diseases, but it is with this one. And I think it's been well documented in medical research that individuals who have less severe cases of COVID-19 have less immunity. And over time, a significant percentage of them lose antibody protection and can be reinfected. Because this is a new pandemic, there's not a lot of cases of reinfection, but there have been some that have been documented. And these cases seem to be very mild or asymptomatic. That's good for individuals who get reinfected, that they're not so sick, but it's really, really bad for us as an epidemic, because what that means is that individuals who have mild COVID, who don't get vaccinated, if they can be potentially reinfected, not know it, and continue the spread of this illness through the population, they can potentially become super spreaders. So it's critical for everyone to get vaccinated. We cannot depend on natural immunity to get us to so-called herd immunity, the level at which prevents spread. We need everyone to get vaccinated, whether or not they've been infected. We do think that a documented infection gives you probably 90 days of reliable immunity. So you don't have to rush. And in fact, those who've had documented cases of COVID may want to let the others, get to the front of the line, because there's a lot of anxiety about getting vaccinated soon. So if you had COVID, you've got 90 days, no need to rush, but you definitely need to get vaccinated. There's a lot of other issues one could comment upon vaccination. From my own particular perspective, I think it's sort of too bad that we opened this up for 65 and older when the 75 and olders hadn't gotten vaccinated yet. Now our oldest, my patients in their 90s are struggling to get vaccinated, just like the people who are 66. So there's an imbalance right now between supply and demand that will improve over time. People should be patient, continue to mask and distance, protect yourselves, get the vaccine. If we wanted to talk about side effects and the reliability, I think is very good on all. This is a good vaccine, better than a few months ago we would have hoped for, reliable, safe, critical for us, both for ourselves and to protect the community to get ourselves vaccinated.
Hey, and Dan, I want to actually turn in a moment to James because for a reason that we'll talk about in just a second. But let me ask you, there has been a discussion about side effects from the vaccines, either Moderna's or Pfizer's. Some folks say, gee, am I actually getting COVID when I get the vaccine? Talk to us a little bit just about the science around the vaccine. Are you actually getting COVID, a little bit of it, when you get the shot? And secondly, what can someone who is 65 or over expect to feel once they've gotten the vaccine overnight, for example?
Yeah, great questions, Mike. So absolutely, you do not get COVID or a little bit of COVID. This is not a live vaccine. There are live vaccines out there, but this is not one of them. This is a slightly novel vaccine, but in that it's an mRNA vaccine, and RNA is what is read by the machinery of the cell to produce our body's proteins, and it gives our body's cellular machinery the ability to make viral-like proteins. And then your body reacts to those because they are foreign proteins and makes an antibody response. So it's just a novel way of giving the protein that your body reacts to. In terms of the side effects, it's a very safe vaccine. At Cedars-Sinai, we've been vaccinating mostly healthcare providers. 12,000 people have so far been vaccinated at Cedars-Sinai. Of these, less than 10 had a reaction significant enough that they required additional observation. So 7 to 10 out of 12,000, very, very small numbers. And those weren't dangerous reactions. Those are just people who needed to have a little bit more observation. Typically, people will get a little sore arm. It's worse. I'm going to, truth here. I'm not going to try to sugarcoat this. A little worse than a flu shot typically, but not horrible. Some people will get a little bit of muscle achiness, particularly after the second vaccination, the booster. But if you've had the shingles vaccine, it seems like this one is a milder vaccine than the shingles vaccine, a little rougher than flu, but not much. So definitely better than a case of COVID. So you're definitely doing yourself a favor, but overall, you're also doing the community a favor by not giving yourself the chance of becoming a spreader.
Thank you, Dan. So when I was a little boy, the doctors had to chase me around the doctor's office to actually get me to stand still enough to get the shot. So I promise I'm not going to do that when it's my turn this time, and none of our viewers should do that either. So let me.
Great. I would chase you, Mike. I'm glad we don't have
to. Thank you very much. So let me turn to James for a second. As I mentioned earlier, I have a reason for turning to him at this juncture, because James, who just looks terrific, as all of us know, had COVID. And James, if you don't feel it's too personal, if you wouldn't mind sharing with our audience a little bit about what you went through when you were sick. And then I want to bounce back to Dan to discuss a little bit about what should happen in James's case vis-a-vis the vaccine. But James, first, You went through it.
I did. I was, the first symptom I had, or symptoms, was lack of appetite. I had no appetite whatsoever. Then I lost my taste, my sense of taste. I lost my sense of smell. And then that lasted for about 2 or 3 days. And then I became extremely weak. And when I felt that weakness coming on, I went to a urgent care center and I was tested. I was tested positive. And not believing it, I went to another one and I was tested positive again. And what happened was, for about 2 weeks, I was incredibly weak. I mean, I did nothing but lie in bed for 2 weeks, and I had no strength whatsoever. I had a lot of chicken soup, which kind of helped me along. That I could eat. I had no solid food whatsoever for those 2 weeks. And then maybe into the third week, I started gaining back some strength. I started exercising on my treadmill and, just walking around doing light weights and things like that. And it took me probably 2 months to come back to almost normal, to where I am now. Took me about I had it in August, so it took me about 3.5 months to come back to totally being normal.
So James, let me ask you, first of all, had we had this conversation earlier, in this audience, you would have gotten bushels of chicken soup mailed to you at home, because there's no question about that.
It's the best cure.
Yes. What do you think was the major factor in your recuperation? What helped you get better fast?
I think the rest. Just resting, and of course, my wife took great care of me. She got it also. She was pretty much asymptomatic. My son, who did visit me, even though I kept him as far away as possible, he never did get COVID. But I think the rest was the most important thing: the chicken soup, the rest, and just being taken care of. I never went to the hospital. Thank God I never had to. So I think just the rest did it, really.
No, thanks, James. And Dan, just to go back to you for a second, before we went on the air, you and James were having a conversation about James getting inoculated. You alluded earlier to the fact that if you get COVID, you have some immunity for a short period of time. Do you want to elaborate on that a little bit?
Well, we don't really have enough experience with this disease to know for sure, but it looks like people have, if they've been infected, 90 days of reliable immunity. After that, it's hard to say. So there's no reason for people who've had it to rush to the front of the line when others have no protection, but they definitely should get vaccinated. Some people worry that if you've had it, you may get a more severe reaction to the vaccine. That's actually not, there's no evidence of that. My patients who've had COVID and those who haven't have had no difference in terms of their reaction to it. So there's no reason to be concerned about that. So Jimmy, it's great that you're doing so well. No one would ever know you had a problem from looking at you. You look super. One of the things I've been wondering about all along, the first few, relatively early on in the pandemic, one of the very early patients, that cohort that was in Italy skiing, and some were, hospitalized and on ventilators. I wrote an article that was published in the LA Times about one individual who was in his 80s and had just a mild cold symptoms and did fine. And we don't know why that is. It's very idiosyncratic disease. Some people obviously die or are deathly ill. Others, just waltz through it. But he was an individual who had impeccable health habits and exercised a lot. And Jimmy, I know you exercise, you have a regular exercise. It makes me wonder whether being in good physical condition, appropriate body weight, and physical activity may have some protective effect. Again, I've not seen any data on that. There certainly are data on ethnic issues and on immune suppressing illnesses like diabetes that make people more vulnerable, but we don't really know for sure what's protective. But lifestyle, it sure can't hurt.
Yeah, thank you, Dan.
Doc, I was going to ask, Mike, may I ask the doctor a question?
Sure.
I've been taking, I was very, very low on vitamin D, and I'm taking, of course, D3 religiously now, and zinc as well. Are those vitamins helpful in building your immunity?
There's a lot of controversy on that, and I think the answer is probably that it's not known. But vitamin D is safe, and there's some question as to whether it might be helpful. I take vitamin D myself because one of the source for vitamin D is the sun. Our skin makes vitamin D based on sun exposure, but we tell people not to get exposure to the sun because we want them to get skin cancer. So in the absence of sun exposure, and this is a fairly temperate climate, there's not as much sun as there is elsewhere. People tend to be vitamin D deficient. So taking up to 1,000 units a day of vitamin D3 is not a bad idea. They sell it at Costco. It's like $8 for 200 or something, and you can take one every other day of the 2,000, and you're covered for that. It's not a bad idea for bone health and general health. So I think that's perfectly okay. For zinc, I would say if you take zinc, I wouldn't take more than 12.5 milligrams a day, which I believe is the RDA. The issue with zinc is it can block copper absorption, and believe it or not, copper is something your body needs, and zinc may block it. People may get zinc deficient. It's possible. There's not a lot of things in the diet that have zinc in them. Beef has some, sunflower seeds, and there's a handful of other things, shellfish. So a lot of people aren't, or may be a little bit zinc deficient. So a little bit of zinc, probably okay, but I certainly wouldn't take a lot of it.
Yeah, because that could build it up in your system, right?
I don't know if it builds up, but it will block absorption of copper. It's not a fat soluble thing. Like it's a salt essentially. So it's water soluble. It should get excreted. Things that are fatty like vitamins A, D, E, and K don't leave, but it should leave. But it can block copper absorption.
Okay.
Good. Thank you both for that. And let me turn to Christina and bring into the conversation, Christina. And it's actually a good time to do that, because you have been a real leader in our office as we've tackled schemes relating to fake cures and fake preventions, vaccine scams, and so on. Why don't you tell our audience a little bit about the most prominent scams we've been confronting when it comes to COVID in particular, recognizing that our audience today is a target audience for scammers. People who are older, who may be socially isolated and feel very vulnerable and anxious. You are a prime target, and we want to prevent you from being a victim in the first place. With that, Christina, you're up.
Great. Yeah, so unfortunately with every difficult time, especially during a pandemic, scammers sort of pop up and come up with they're very entrepreneurial in bad times, unfortunately. So we've seen a proliferation of a variety of different scams. The first scams that we were confronting were related to COVID test kits. So people who wanted to get kits at home to be able to test for COVID, we found people selling test kits that had not had FDA approval for that purpose. And so we actually brought 4 lawsuits in that area. 3 of them did settle, everyone got their money back, and the 4th one we're still litigating. But that was an area in which people were thinking, okay, I can get my own test kit when it was difficult to get tests, and that, again, was not really the case, and that was a real concern. We're also concerned about that in connection with vaccines. So in general, one of the biggest scams, especially that target seniors, are what we call imposter scams. So, you name it, they try to be at the Social Security Administration, the Medicare, but now we're seeing the possibility of them doing it with the vaccine issue. So, congratulations, you're allowed to get the vaccine. We're sending you a special email. Just pay this fee or give us your personal information or fill out X, Y, and Z form. So, we really do want people to be careful about all of that. If you're asked to pay out of pocket for a vaccine, that is definitely a red flag. If you're asked to put your name on a waiting list to get certain entry or access, again, that isn't directly from a site you're going to that is a government site. So, for example, in the city of LA, the website is carbonhealth.com, and that's where people should be going to sign up for vaccines if they're in the categories of the 65 or older or healthcare workers. So we want people to be aware that you should be seeking out the resources to go look for either testing kits or the vaccines, and not really accepting incoming solicitations from people you don't know or aren't familiar with.
Yeah, Christina,
and yours too.
I was going to say, it's so important, Christina, the points that you've made, that people don't have to pay for the vaccine. People shouldn't have to give their credit card information online, for example, to get the vaccine. People cannot pay to get higher up in line for the vaccine, no matter how eager we are. And yet, some of our viewers may have experienced some or all of those problems. And we want to arm you today with the armor you need to prevent yourself from falling victim to this, because when they ask for personal identifying information or money, there are two things they want. They want your money, but they also want to get access to your identifying information so they can steal your identity. And we don't want that to happen to you. And I will say parenthetically, if anybody on this Zoom event today or watching this event has identified a scam, people reached out to you and you have information about it, contact us at lacityattorney.org, because we'll follow up. Christina, thank you. I'll return to you in just a second. Let me go back to Dr. Stone for a second. Dan, we're going to talk about issues beyond COVID today. I think each of us in our households has probably had enough COVID conversations to last for a lifetime. But I do want to point out that so many of members of this particular audience are grappling with something else, and that is isolation. One of the purposes of High Village in the first place was to prevent people from being isolated from each other and create a meaningful sense of community, which has been great. But still, COVID, which came into being long after High Village was started, has impeded people from connecting with each other in person. So let me ask you a little bit about the mental and physical consequences of isolation, and more importantly, what our audience can do if they, in this crisis, find themselves isolated. Dan?
Well, that's a great point, Mike. I think we're a social species, and I think that social interaction is critical to human health, and that's part of why synagogues exist and why groups like this exist. I think that they are serving a basic need of mankind to provide that kind of social interaction. We do that because it's exchange of information that's so helpful to us in our daily lives, and even survival. I think it's probably literally and figuratively built into our DNA. And when people miss that, I think there is a tendency to spiral down into depression. And when people are depressed, they tend not to sleep, eat, function, have low energy. And then with that, they tend less to even reach out. And then that sort of becomes part of a cycle as they become more depressed. So I think it's important for all of us to try to stay in touch with our family and friends. I most tragically had a colleague who committed suicide in the last month, and that's something obviously that is for the whole community is never the same. So I think all of us should be proactive in reaching out to those who seem to be in need, or those who may not be in need. It's always good to touch base with people via Zoom is a nice substitute until we can get social interaction. The email, phone calls, we really should in our community, and we can make a difference in each other's health by reaching out and making sure that we're all in this together.
Thank you, Dan. Let me turn to James for a second. So let me ask you, everybody who's watching this is looking at you and saying, you're 84 years young, you look terrific, and everybody's going to want to be you after this event is done. Can you give those who are watching some hints that have enabled you to thrive in the most meaningful sense as you've gotten older?
Well, I'm just going to say, thanks to dyslexia, which I have a bit of, I'm 48 years old. I was going to ask Dr. Stone a question about that depression thing. If after having COVID, if that does add to your depression, because I've had some battles with that recently. And I'm sorry, your question was what specifically, Mike?
Well, let's do this. First, why don't we have Dan answer your question about depression, and then I'll turn back to you because I wanted to talk to you about the things that you've done for yourself that enable you to thrive. But Dan, first, why don't you answer the question that James poses, which is depression a consequence of COVID sometimes?
Yeah.
I don't think we really know enough about the illness now to know for sure if there is more depression associated than any other profound illness. But we know that, for example, with heart disease, when people have a heart attack, it's definitely associated with depression. And those who remain depressed have a poor prognosis. My suspicion is that it will probably turn out to be the case with COVID. Any illness where you are disabled, bedbound, of course, in the middle of an epidemic where you're not able to interact, is going to have a tendency to cause you to be depressed, particularly when you can't do the activities that keep you mentally active. Those activities we do, the physical and mental activities, keep us going. So it's important if you know someone who's had COVID, stay in touch with them to make sure that they're doing okay. It may turn out that this is a particularly depressing disease, that there are brain issues. We know that COVID affects the brain. That's how you lose your sense, how people lose their sense of smell, is brain effects. So it's certainly possible it may turn out to be more predisposed to causing depression, but any profound illness like that can lead to depression.
Yeah.
Well, I mean, I've had more depression than usual after COVID. I don't know if it's COVID and the lockdown or both, or just or more COVID.
Yeah.
Well, let me just say one comment that there's usually three things I tell people to improve mood without using medications, and those are physical activity, which you do,
right.
Spending outdoor time when weather allows, and trying
Absolutely.
to make those activities that they usually enjoy, which when they're depressed, they'll often leave off. Medication is an important adjunct. Most people don't need it, but for people who aren't responding, medication can make a big difference. It can be a temporary thing to bring people back up to the level of function. Certainly, if depression is persisting more than 2 weeks, it warrants medical evaluation.
Okay.
And so, James, let's turn back, though, to the fact that you have a very active lifestyle. What are some elements of your day-to-day life which you have relied upon over the course of your life, especially if you've gotten older, to keep you this vibrant, vital person you are?
Well, I think one of the things that the doctor mentioned is to be outdoors. I'd like, it's easy to walk on my treadmill and get that exercise. But if I go hiking or spend more time outside, to me, it's much more satisfying. It clears my head. I get out of the house, of course. I constantly rehearse. I rehearse every day my vocal exercises and go through my show that I once did before COVID at least 3 or 4 times a week, the entire show. So I just try to keep as active as I possibly can. I don't, but I think getting outdoors and spending time, even though keep a safe distance, of course, but spending time with people, I think that's so bloody important. I mean, I miss it so much, as we all do, because of this lockdown.
And then let me ask you, you have a unique career in that you have to memorize a lot of information, lyrics to songs, for example, scripts. How has the memorization process benefited you as you've gotten older, do you think?
Well, I don't know. I keep doing exercises to try to keep my memory sharp. with music, it's totally different. A lyric, you remember your lyrics lots of times because of the music. The music takes you into that lyric somehow. Why, I don't know, but it does. But I'll do exercises. I've mentioned it before on our talks. When your toothpaste is usually right next to the sink, blah, blah, blah. I'll take it the night before and put it in a drawer and get up the next morning and remember exactly where I put it. And so I'll do things like that. I'll put different objects in places that they don't normally go. And because of that, and I'm proud of myself when I wake up the next morning, I say, oh, my shoes are in the hamper. I mean, anything that makes me use my head. I mean, anything that challenges my brain is what I try to do. And I must say, I do have a great memory. I really do. And I guess it's, I don't know, maybe through singing and through learning hundreds of songs and doing these exercises that I do.
Yeah, and I think this is a good hint for our viewers to remain active and vibrant and mentally acute. I think the process of memorizing, even now, in the course of one's day, certain things is helpful because there's some muscle memory associated with that in your brain. So let me turn to Christina for a second and ask you, we've been talking earlier about what an individual can do to thrive, about the consequences of isolation. It's also true that there are people who are watching today who, once COVID is finished, are going to be thinking, do I want to continue to live by myself? Or should I be looking to live in some assisted setting of some kind? Talk to our viewers a little bit, if you would, about the factors they should take into account when making that decision and when looking around.
Right, absolutely. So in terms of assisted living facilities, there's a couple of different options. Of course, there are nursing homes that are available, and we would encourage you to look on Medicare.gov, in which case you can get information about ratings for facilities, and really encourage you to do your research in terms of looking at numbers of complaints they received, if they received any citations from the Department of Public Health, things like that, to give you a sense as to how well the facility is doing. Of course, the opportunity to go and look at the facility yourselves, if they're willing to let you talk to residents, things like that, to really get a real sense as to how is that facility and will it meet your needs, I think is a really important thing to be looking to. Again, doing a lot of research on facilities like that in advance. Also, if you're looking for assisted living itself, you can look at, there's a website, it's ccld.ca.gov, and we can send these out later if that's helpful, but that's a place where you can start to do some looking for assisted living facilities and look for some background information. The other place that you can look is to connect with Wise and Healthy Aging. They are an ombudsman service. It's a nonprofit, and they also are funded in part by the state for some of their services. And they're good both in getting information about these kinds of facilities, and also if you have a problem or an issue or a loved one does, they do a wonderful job of trying to help people address concerns they may have if a facility is asking someone to leave before you really think that they're ready to do so, or if there's other concerns about treatment of patients. So looking at the whole of the facility and knowing where to go if you have complaints or questions is a really important thing to do, and really doing your research. And similarly, if there's ever anybody who has a need for hospice or who's approached on hospice, we've had some concerns and seen some reports about people being talked into hospice care when they may not really be in a position in their life where hospice is appropriate. So people don't understand, if you sign up for hospice, you are giving up all rights to further treatment. And so hospice is really meant for people with a terminal illness in 6 months. So we have had some reports of people talking people into signing up for hospice and saying, oh, you get all these benefits, you get extra help and all of those things, but not realizing you're then giving up your, for example, Medicare coverage if you have a medical event. So just really being cautious as to what you may or may not sign up for, asking questions, having a family member involved too is very helpful.
Thank you, Christina. Let me return to one aspect of that selection process if you decide to look for a congregate setting in which to live. Many members of this audience know I used to direct Bet Sedek Legal Services, that means House of Justice, and does free legal work for seniors, people who are disabled, and others. And one aspect of Betsedic's work is to protect people in nursing homes. I learned early on when I was running Betsedic about the importance of having a location that is relatively close to where you have loved ones, so they can visit you frequently. Christina, is that still important? And if so, can you explain why?
Absolutely. I mean, having that interaction, having family members who are able to come and visit and to look after you and to communicate with staff is a really important thing. And the other thing that people are allowed to have that they may not realize is called a family caregiver, family decision maker. And so it's really important if you are in one of those facilities or if you have a family member who is, that you provide your name and information. And that way for important events, they will and are required to call and update you and let you know. For example, if there's something going on with your family member, or if you would like your family member to know, that's part of the process. And so it's important that you are able to remain in communication. Sometimes there are issues that arise, and you really do want a family member who can come and identify, and advocate for you if there's something that isn't quite right or you need some additional assistance. So absolutely, closest to friends and family is key.
And I think there's some research that shows too that in congregant settings, the residents whose family members are there the most often get the best attention, in part because the place is cognizant that people are looking in on what's going on, and that interaction benefits everybody. So just wanted to add that to Christina's very effective advice. Before I have a number of questions from our viewers, which is just great, and again, you can keep sending them through the chat function. I'm going to turn to those questions in just a few moments. Before I do, Dr. Stone, Dan, help us out with something. There are so many do's and don'ts regarding health as we get older. We've discussed a number of them so far today. Could you please elaborate on a few things that we haven't mentioned so far, steps that our viewers can take, both to prevent their health, mental or physical, from deteriorating, and to promote a feeling of positivity moving forward, good things happening? What would you add to what we've discussed so far?
Sure. Well, let me first just say in regard to that and comment on Jimmy's comments. I think Jimmy could have been a great neuroscientist. He made in just a brief comment two fascinating observations. One is about singing, helping you remember the words, because music's on the right side of the brain, words are, and vocal is on the left side of the brain. You're sort of cross-referencing. So I think that's a very real phenomenon. And also the comment about placing different things in different places is kind of a way of cross-referencing. It's sort of an out-of-the-box kind of thing. And that sort of thinking, the out-of-the-box thinking, doing something different, learning a new skill, those sort of things promote mental wellness and intelligence. And I think that's great. And it shows how it's benefited you. Those are great ideas. And those and others, there's a couple of books by Gary Small, who's a geriatrician researcher and memory researcher at UCLA. One's called The Memory Bible, and there's others that sort of give these tips as to how to stay mentally alert. And those are a couple of really good ones, Jimmy, that you provided. So in addition to that, there's a lot of basics that I think people are familiar with, the things your parents would have told you: stay physically fit, stay physically active, maintain your body weight, eat a nutritious diet, go to the doctor, go to the dentist. Those things are all standard healthcare. Sometimes we focus on the smaller things and not so much the bigger things. In terms of sort of mental wellness, the other thing I might mention is that we sometimes underestimate the benefits potentially of meditation. There's some interesting research going on in meditation in modern healthcare now. And at Cedars-Sinai, we're partnering with Headspace, which is a meditation app. And I would encourage people to try it. It's very good for calmness and concentration. And I think those things lead to more satisfaction in life. So Headspace is one. There's others like Calm app, phone apps, or you can get them online. I think in a time of great stress, a few moments of relaxed focus can make a big difference in people's lives. So there's and of course, I think experiencing life with others, as we talked about, social engagement, I think those are the basics. I think if people can do those handful of things on a regular basis, I think they'll, like Jimmy has shown us, a perfect example of how those things add up to a healthy life.
So Dan, by the way, let me ask you, I'm sure there are viewers who hear the word meditation and think, oh, that's just something that people on the fringe do. Do you meditate?
I do, actually. I've been meditating for, let's see, it's been about 40 years now, and I'm going to get it right sometime soon. But a lot of people feel that they're not getting it right. And one of the keys to meditation is if you're doing it right. Just keep doing it and you get better with time. But there's all different kinds. And one book that I recommend is The Relaxation Response by Herbert Benson, who's a Harvard researcher, who talks about really the physiologic, it's a non-religious book about the very secular scientific basis for meditation. And one could start with that, but really there's good scientific evidence that meditation has physiologic benefits, and they're being explored and clarified.
Terrific. I have more questions for our terrific panel, but I also have a number of questions that we've received from people watching on Zoom, so I'll turn to those. Dan mentioned lessons from our parents. I will point out that, unless I miss my guess, both my mom and my mother-in-law are watching today, which reminds me, as Jimmy is smiling, there's that old joke that behind every successful man is a surprised mother-in-law. So we'll talk more about that. All right. So let me turn to questions. So we have a question. I'm not going to mention the person from whom it comes in each case. This question is, will getting a spinal block, Dr. Stone, interfere with getting a Pfizer vaccine shortly before or after the block?
Quite possibly. Usually a spinal block is cortisone. There's various forms of cortisone, and spinal blocks are usually a substantial dose. Even though they're given locally, they tend to get absorbed and can potentially impair immune response. So a COVID vaccine is a pretty important thing. And I would not want anybody to be taking any cortisone, including a spinal block, within 2 weeks of having a vaccine. I think if you want to have that, I would have it either 2 weeks before or 2 weeks after. Thank
you very much, Dan. That's very helpful information. And while we're on the vaccine, I have a couple more questions that are specific to the vaccine issue. And I think Dr. Stone is the best person to handle these, although it may be that you don't have the information either, because I know how confusing the system has been to get a vaccine in the first place. There's this question. My husband and I got our first dose of the Pfizer vaccine 6 days ago, and he, but not I, got a personalized message stating he'd be getting an appointment for his second shot. The call number for the vaccine at LA County was not helpful, the person says. Meanwhile, neither of us has received a date for a second dose. We know other people who have. What should we do? I don't know that that's in your expertise, but I think that's a question that I'd point to you anyway.
Well, I think that you should obviously pursue that and try to get an appointment for both. But I think the whole COVID situation, how it's been held, shows that we really need some sort of nationally coordinated health service. We don't need necessarily, people get up in arms. I'm not saying necessarily socialized healthcare, but we ought to have a centrally coordinated system. We ought to have medical records that speak to each other. So if you go to San Francisco, New York, people can access your medical records so that what you're due for and what you're not, so the doctors don't order a medication on one person and not knowing that they're on another one that could interact. This has really reflected to us the failings of our system, and I think that question points to that sort of lack of coordination. We pay far more than any other country in the world for healthcare, and this just shows us we're not even getting the kind of healthcare that they're getting in places like New Zealand, Taiwan, North Korea. We should really be doing better.
Yeah, and I think so. The direct answer, though, to the questioner is, besides persistence with the phone number and I don't know what else to do at this point, it's extremely important to get a timely second vaccine. And I don't think that you're unique in this question. And by the way, Dan, really quickly, not to cause concern, but to assure people are informed. What happens if you don't get the vaccine, the second dose of the vaccine, within an appropriate period of time?
Well, I think no one really knows, but my suspicion is that if people get it within a reasonable amount of time, I don't think there's any reason to think that the second vaccine won't work as well if it's given 2 weeks later. because, remember what's being given in the vaccine is the mRNA. It generates a protein that's a viral protein. Your body reacts to that. And then the mRNA is degraded and you're left with an antibody and some cells that have been sensitized. There's no reason to produce that antibody. There's no reason to think that anything's happened to those cells in 4 weeks that, in 6 weeks wouldn't happen in 4. One vaccine used 3 weeks as the interval. The Pfizer vaccine uses a 3-week interval. The Mrna Vaccine uses a 4-week interval. You might have used a 6-week interval. They didn't. It's nice to replicate what was done in the study because we know that it worked. But if people have it a week or 2 weeks later, I don't think there's any reason to think that the response is going to be different. Try to get it on time, obviously, but don't panic. If you get it a week or 2 later, the chances are you're going to have, for one thing, you have 50% immunity, which is good, which is not bad. With the first vaccine, it probably boosts to 95%. I don't think there's any reason to think that 2 weeks is going to make a big difference in that.
That'll have a real calming impact for our audience. Thank you, Dr. Stone.
Michael, I had a question that's really, I think, important. If you get the Pfizer vaccine, and could you get the Mrna as a booster, or should you stay with just one vaccine?
Yeah, that would really be getting into terra incognita. I think that you don't want to sort of be playing around with changing a different vaccine. One's a 0.3 cc's, one's 0.5. Who knows? I think there's no reason why there shouldn't be the same vaccine available to get the same thing so that you can be pretty sure you're replicating what was done in a study. So people shouldn't be doing studies on themselves. People should get the same vaccine that they got at the appropriate.
And how do they know which one they got?
Oh, well, it should be on the vaccine card. Everybody should get a card when they get their vaccine. So it should say on the card what vaccine you got.
Yes, okay. That is in fact the information the county provides, that card will be available. Christina, let me turn to you for a moment. We have a question about what people should do if someone they love has been affected by a scam, and they also are asking for a phone number. Can you repeat a little bit about how they can contact our office, mention other resources they might turn to, and if there's a phone number in our office, what number they should call?
Sure. Yeah. I mean, I think there are, several different options. One option is our office has a number, which I'll have to get in a minute. I don't have it at the top of my head, but I will. But also the Federal Trade Commission also accepts information, and that database is accessible to lots of different law enforcement agencies, including our office. So if it's outside of LA City, that also is an option as well. We work pretty broadly. But I think reporting the issue is the most important thing. And, the more places you report it, the better, I would say. But the Federal Trade Commission, FTC.gov, there's, of course, on the LA City Attorney's website, there's a link for consumer complaints. That's a great way to do it. And there's a lot of information we get from those online complaints. And then I'll get the number for you. I didn't have it off the top, but we also accept phone call complaints as well. So, yeah, I mean, I think as much information as you can provide, we really appreciate getting that. If it's an actual, like a larger crime that you think the FBI or others are interested in, their website is IC3, I as in icicle, C as in cat, 3.gov, and that's the FBI's database for large-scale fraud and complaints, and other law enforcement also can access that as well. So a couple of different resources depending on the type of fraud you're dealing with, but we work very closely with other law enforcement agencies, and so we share resources, and something comes to us and it doesn't fit what we do, we refer it out to other agencies that have the jurisdiction.
And in fact, during COVID, we've been the recipients of referrals and collaboration with federal partners who've reached out to our office because we, and in particular Christina, are well known for being effective at what we do. And Christina, I think that what we can do logistically is in the next day or two is to send to our friends at High Village a piece of, a short email that contains information about where they can go, because High Village, I know, has the capacity to disseminate that among its participants. So we can do that. And absolutely. let me turn to a completely different topic for any of our panelists to respond to. The question comes, many of us spend a lot of time on Zoom. What do you think the long-term impact of that is going to be? Anybody?
Well, for me, I don't spend half the time. This is my second Zoom call in 9 months. So I'd much rather be outside, working in the garden or trimming a tree or doing anything physical than being on Zoom, even though it's great.
Yeah. Others? I mean, I do think that the experiment of Zoom is, can we try to maintain some human contact without physically being close to each other? And this is, of course, a pale imitation of what it's like to be in the same room. But yet there's at least some interaction. And I think, Dan, you would say, I'm interested in your comment on this, that anything we can do, especially in this anomaly of a lockdown during a pandemic, to escape being completely isolated is much better than the alternative. And even though Zoom doesn't do it for a lot of people, it is much better than no contact at all. Would that be your thought, or how would you elaborate on that?
That is my thought, Mike. I thought that was very well said. The thing I would be concerned about is for the longer run future, I don't think Zoom is as good as face-to-face. It's the next best thing, but it may end up becoming a substitute for people who are not commuting, staying at home. Offices may change. But if I can take the conversation in a slightly different direction, although I maybe worry a little bit about that, what I really worry about is social media, because in particular, in regard to vaccines, I'm worried that we're not going to get enough people vaccinated for COVID to get to herd immunity. And I've been worried about measles and other vaccinations. And if you take a look at what happened with polio in the 1950s, there was no opposition to that. Why was that? People were getting their news and information from responsible organizations like CBS, NBC, and ABC, and now people are getting it from social media. And social media amplifies non-scientific hearsay, and it creates a substantial opposition that's based on lack of truth. And I think we're losing the ability to have consensus on truth, and that's been discussed extensively in regard to what's happened with the epidemic. And we really need to have, I think, to put effort into making sure that people understand there is truth. Science is the search for truth wherever it leads, and that there should be respect for that. We should act on that. That helps us to protect lives.
Thank you, Dan. Another question that takes us in a little bit different direction. The questioner says, Chi Village LA launched 6 multi-generational programs this year, thanks to a grant from the Natan Fund. We recognize, the questioner writes, the benefits for all age groups, college students, high school students, teens, and so forth. Is there a mechanism for others in Los Angeles to participate in multi-generational programs? It's a great question. I don't know if any of our panelists has a comment on that. I will say the City of Los Angeles has a Department of Aging, and one of its missions is to create programming that will include some multi-generational components to it. If we have information on the current status of those in COVID, we'll provide it. I'm sure that COVID has inhibited that from happening so far. But I'm a big fan personally, as a civic leader, of multi-generational communication. I think it's really important that to keep us young and vital, we communicate with people in different age groups whenever we possibly can. And we can do that through volunteering, we can do that through social engagements we have. There are many ways to do that. But that's a real key, I think. I don't know if anybody on the panel wishes to comment on the question or what I said, but I'd welcome that opportunity now.
Yeah, I mean, I think that makes a lot of sense. Obviously, those kinds of programs are great. And I think having that kind of communication is so important, even with, of course, the things that we see on the consumer scam side. We really find that when people are isolated and not connecting with others, that's when they're most vulnerable. And having that connection and talking to family and friends and different multi-generational groups helps give some perspective, to people who may think that something that's been offered to them is sort of something that's good for them, or that this is a great deal. And, you can get that different perspective. And I think seniors can offer that perspective to the younger generations too. So I think it's really a great way that people can all benefit from each other's different levels of experience. And it's a great program, sounds like.
Thanks, Christina.
I agree with that too. I agree with that too. That makes good sense to me.
So let me say to our audience, we have enough time for a few more questions. I have a couple that I will ask on your behalf, but you still have an opportunity to put a question in the chat box. We would welcome the opportunity to respond to what you care about the most. Going back to the vaccine, and I do have to say to our panelists, I am sure that that is the top of mind issue for everybody who has tuned in today. The question, which may not be answerable by this panel, is how is the county going to ensure that people 75 and over get the vaccine? And this questioner appreciated Dr. Stone's point earlier that they shouldn't have started at 65 and older just yet. I don't know if anybody on this panel has any insight about that. I would welcome your input.
Well, I'll just jump in. I'm not sure what their plan is going to be. I can say I know in other parts of California, they've set up separate sites where people can actually go just for those who are 75 and older. So, in a different other cities, this is the location for 75 and older, and you can make the appointment. And those locations, truthfully, also have moved much more quickly, right? Because there's fewer people. And then there's another location that's for 65 and the 65 and older. And I think that, maybe something people want to think about doing here so that there is some sort of differentiation, particularly in people who are in those age groups. It's obviously a lot harder to be sitting and waiting for longer time periods and, even though you have an appointment, you have to wait 3-4 hours, that's an issue. So, I would hope they would consider doing something like that, where even if it is open to others, there's maybe some differentiation so people over 65 can have a sort of a different location, in which case there would be more, maybe move a little quicker and there'd be more certainty as to them getting doses.
Yeah, Christina, go ahead, Jimmy.
Yeah, there's something that confuses me. Why do the primary doctors, our primary doctors, not have access to the vaccine? I know they have an abundant supply or a good supply of the vaccine. How come our primary doctors can't administer the vaccine to seniors, to people 75 and older, 65 and older, whatever?
Well, Jimmy, for the Pfizer vaccine, the problem is that it requires ultra refrigeration, and that's expensive, so it has to be done through a medical center.
But Moderna is just refrigeration, right?
Yeah, so I'm not sure what the requirements are for that, but I think the concern was to make sure that it's done in an orderly fashion, and they wanted to do it centralized. To disseminate that to hundreds or thousands of doctors' offices would be different. Some doctors do have that, but most of us don't. Mike, a couple of comments I would make just based on my patient's experience and the information I've gotten back is that the county sites are working better than you might think. The feedback I've gotten, for example, from the Dodger Stadium site has been quite good, really. Most people are telling me that it takes an hour to get through from start to finish, including the 15-minute observation period after getting the vaccine. So it seems to be working, although obviously the lines are still long. It's probably going to take a few weeks to get through this, so people should try to be patient. Right now, we have a situation where the demand exceeds the supply of the vaccine. In a few weeks, I think we'll get to the point where it meets the vaccine, and then the longer run problem is we're going to have more vaccine than willing people to take it. So everybody should encourage their friends, family, and everyone else to take the vaccine. We really need to do this. That's going to be the long run problem is we have the vaccine, but people won't take it.
Interesting. And Christina, to your point, the city requires grocery stores, since the pandemic started, to open that first hour only for seniors. And your point is you could imagine a vaccination dissemination regime that looked very much the same. That's just one approach that one could take. No, I as you can tell, I'm not involved in the logistics of the vaccine process. Sometimes I yell at the computer as though I wish I were in that process. But I think at this point, and then because another questioner came in that says, how can I get the vaccine already? Well, I think all of us understand that frustration. I don't think any of us has a particular insight. My understanding is that this week, all the county sites are full, but that a new batch of appointments will be available for next week if that hasn't already happened. That's my best information. I don't know if there's more up to date than that. Christina, by the way, because she is so effective, even as she was answering a question, was busy typing and sent in the following information that we can all take advantage of. So if you want to communicate a concern about a potential scam, or have a question, or think a loved one might have been victimized and so on, you can go to our website, and I'm going to read it to you, but we'll also disseminate it in writing later on. So https://www.lacityantorney.org/concern consumer complaints, one word. I'll read that again, www.lacityattorney.org/consumer complaints, one word. You can also call a phone number. Christina, I take it this is not your personal cell phone number, but it is a phone number to give. All right, 213-978-8070. 213-978-8070 is a number to call in our office if you or someone you know has been victimized or is cognizant of a scam that's circulating out there. And I really want to emphasize, another questioner asked, what are we doing as an office, the City Attorney's Office, to educate consumers so they can be on the lookout for scams and be inoculated to scams? We're doing programs like this. We do press announcements. We send out stuff on social media. We communicate with newspapers and others about emerging scams. And sometimes we learn about those scams from you. So not only are you benefiting yourself, you're performing a real public service when you provide us with information that enables us to go on TV or the radio or the internet and communicate to others so they can be not victimized, but actually on the lookout to prevent a problem, and we can help put a stop to it. So thank you, Christina, for that multitasking. That was pretty good. So I want to turn to our panelists and ask you this. How important is it for you to maintain a positive outlook as we thrive, as we get older? And what do you do, starting with Jimmy, what do you do to maintain that positive outlook, which we've identified as being so important?
For me, I think young. You know, I mean, there's certain things I can't do that I was able to do 10 years ago or 5 years ago, but I try to keep as active as I possibly can and spend, well, when I can, of course, spend time when this COVID thing is gone, spend time with friends and music. Music to me is the most important thing ever, aside from my family, of course. Music can take you everywhere and anywhere you want to go and can brighten up your life more than anything. I mean, it's fantastic. It doesn't have to be your favorite song, but you'll hear a song like some of my favorite songs from Motown that'll bring me back to an era or a time that just lights up my entire body. I just feel incredible, and it keeps me happy, and it keeps me young.
We are so grateful to our friends at LA Cityview Channel 35 to be having this in studio today, but had we really been on the ball, we would have been having background music leading in and out of the show from Jimmy Darren. But next time we will
I was going to play Fats Domino. I have him on the turntable here.
But we don't have Fats Domino with us. We have you with us today. So here I do have a couple of questions, by the way, that just came in. One question is about the vaccine. Can homebound seniors have a nurse come to them? So first question, can that happen? Forgetting COVID, can homebound seniors have a nurse come to them? And then specific to COVID, can that happen with a vaccine? Dan, you want to answer that?
I have not heard of that being available. I think at this stage of the pandemic, where from a public health perspective, you want to get the most vaccines to the most people, to have home health nurses taking vaccine and delivering would be probably not the most efficient means. But in addition, in regard to the refrigeration requirements for the Pfizer vaccine, it wouldn't be a possibility, I don't think, or it would be difficult, it would be challenging, and I don't know about the Mrna vaccine. So it's possible later in the pandemic. Obviously those people who can't get out, we would like to get them vaccinated too to protect them. But I'm not sure if the current supply and the technology will support that.
But I do want to emphasize, beyond COVID for a moment, that one method that many seniors use to live in their homes on their own is to have home health care workers in general come provide assistance to them. And there are organizations that provide that help. And if you want more information about that, we and others can disseminate it to you. Because while many people thrive in congregate settings, other people want to say, no, I want to live the way I've always lived, And while that may make it more complicated for me to get the basic activities of daily living accomplished, I'll have someone come in and help me do that and have kind of the best of both worlds. That is a technique that people use to thrive. And Dr. Stone, even though we've discussed this for a second, I'd like a definitive answer to this. A questioner just put a question to us. If you've had COVID, should I still get the vaccine?
Yes, that comes back to what we talked about at the very beginning. So the immunity for natural disease is not as reliable. We think it lasts at least 90 days, but for those who have mild disease, their antibodies levels have been documented to fall and they can potentially get reinfected. And the concern is that asymptomatic reinfection could spread the disease. So you're helping yourself and helping others if you've had the disease to get vaccinated anyway. Vaccination is more reliable immunity, more protection for yourself and for the community. So it's very safe, no different than people who've not had the disease. If you've had it, you don't have to get to the front of the line because you've got 90 days, but do get vaccinated.
Thank you, Dan. Christina, I do want to turn to one more question since we have about just a few minutes left that takes us back to the world of consumer protection here. I know for a fact that there are dozens of people watching right now who are potential victims of scams on the internet because they're less familiar with how computers work and how the internet works and could be vulnerable to getting ripped off, sharing their personal information, having their identity stolen, and so on. Can you provide a few salient tips to our newly computer-savvy audience about how they can protect themselves?
Right, absolutely. So, most importantly, always be suspicious of people who are reaching out to you and asking you for personally identifiable information, for money, especially if it's in connection with a gift card. That is one of the common ways that people commit scams is, oh, you need to pay me with an Apple gift card or an Amazon gift card or whatever else, because those are untraceable. Or if they're really just offering you, some sort of a benefit and you don't know who these people are. So really watching out for unsolicited communications where people are offering you particular items or particular things that are supposed to be good for you. You should really be doing your own research to look for things that you want. If you want to buy something, if you think there's a problem with your computer and you get a pop-up from supposedly Apple support, don't believe it. If you want to talk to Apple, you know how to go to apple.com or call a phone number and reach out to them directly. But, just be very careful about unsolicited communications, people reaching out to you, and again, giving out your personal information to someone you don't know. We like to say, think about how you would act if that person came to your door and said, Mrs. Jones, I'd really like to have your mother's maiden name and social security number and all of this other information so that you can make this purchase. You wouldn't really give it to them if you even seeing them face to face. So think about how much more concerned you should be with someone you don't know, because you really don't know who's on the other side of the computer. And we have scams really coming from all over the world. And the computer allows people to hide and pretend to be people they're not. And so that is a real concern of things you should watch out.
Christina, what a great way to frame the caution to our viewers. If you wouldn't give the information to someone who you didn't know who knocked on your front door, why would you give it to someone you don't know on the internet? That is something that every viewer of this presentation can remember. And you mentioned, by the way...
Michael, that's an analogy I use.
Go ahead.
If someone knocks on your door, you don't just open the door. You ask who it is. If they say I have a package. If you're not expecting a package, you ask to leave it at the door and wait, look through your window and wait for them to leave. On the computer, I have my son's neighbors. Someone called them and they said they were from a collection agency. That's another scam. And you owe whatever, $1,000, but we can settle this today if you give me your credit card, and we'll take it down to $200. So all these things, but the front door thing is a great analogy. If you don't know, you'll never open your door for anybody. I don't. And unless I know exactly who it is, if I'm expecting somebody, and if I'm not, I don't do it. I just don't open the door, period.
These are very good observations. I got another question that came in, which, by the way, I think is terrific. We have a couple minutes left, and I'm glad we got another question recently. This questioner writes, I'm still confused. And this is Dan for you. Dr. Stone, once I have the second dose of the vaccine, can I still contract COVID and pass it on to others?
Well, we don't really know the answer to that question based on what, the study. They tested for symptomatic COVID, and the 95% of people were protected. There was a 95% reduction versus people who got placebo in symptomatic infection. So could it be possible that with time, the antibody level might drop and you could get an asymptomatic infection and spread it? Well, it's possible. These are still new vaccines and a new disease. I think the likeliest thing is that you won't get it and you won't spread it, but we just don't know for sure. So you can't say 100% that you couldn't spread it at some point. So probably for that reason, we're going to have a period of masking and distancing beyond when people are vaccinated. So stay tuned to public health authorities as to what those, as we ease up, hopefully. But there's still a lot that's not known for sure, and that's one of the issues it's not.
Thank you, Dan. We have covered so much territory in a relatively short time. I want to give each of our panelists an opportunity to share a final thought on any facet of issues we've discussed today, or something that would help our audience thrive that we haven't had a chance to touch on. Please, let me turn to Dr. Stone first. Dan, any final words you want to share about any aspect of our conversation?
Well, it's been a great discussion of a lot of interesting topics. I would just say one of the things I was thinking about when we talked about what you do to keep yourself going, to keep your mood up, I'm thinking of my patients who retire and what retirement means. And a lot of times my patients think that retirement is a vacation that just doesn't stop. And for 2 weeks it is. But then after that, people realize that there's sort of a lag and they sort of lose momentum. I think people need to wake up with a sense of purpose in the morning. And whatever it is, it can be just taking care of your grandkids or your kids, or it can be a job. But for people who are thinking of retiring, I think it's good to line up that sense of purpose. And I think when people have that, when they wake up in the morning with something to do and a plan to do it, that makes life worth living and energizes people and keeps them on their toes. So I would encourage people to try to approach life that way. And I think along with the other advice, I think it'll help them thrive.
Dan, that is such an important insight. And I just want to build on it for a second. I think that for most of us, as we get older, the amount of money we have, the cars we drive, the size of our house, really pale in comparison to the meaning we've brought into the lives of other people. And even though COVID does for the moment make it harder for us to connect with other people, whether intergenerationally, whether with a relative or a friend, or just with a group of seniors we're hanging out with, I know it's been tough during this period, but this period is going to pass. And I think focusing on what it is in your life that has brought you the most meaning. It could be volunteering to help someone who's in a crisis. In Jimmy's case, it could be the rewards one gets from being involved with music. There are all kinds of ways to find meaning in your life. And I would say that there's no way to thrive unless you do have that meaning, that sense of purpose that Dan describes. And it might even involve awakening during COVID, having the night before create a list of things to do the next day, even prosaic things, just to give your life some structure and some sense of purpose. Jimmy, you're up. Last words.
I think you hit on it when you said structure. I do that every evening almost. I have a list of things I have to do the next day. Now, just to keep myself busy, this is going to sound insane, but if I have nothing to do, I always have my rehearsals, vocal exercises, etc. But sometimes I'll go, I know this sounds crazy, I'll go to a hardware store, which I love. I'll fill up my cart with everything and then put it all back. Only because it keeps me active, it keeps me doing something, it keeps me thinking. I'll buy things that I have a dozen of, and I'll just put them all back on the shelf and leave the store. It sounds a bit insane, but it takes up some of my time. and I enjoy it.
Thank you, Jimmy, that you're going to win the Customer of the Year award from your neighborhood retailers. So, Christina, we have about 15 seconds. Final words?
Just trust your instincts. Don't be afraid to talk to friends and family with respect to purchases and things, people who are approaching you on things that might seem a little too good to be true. And really just be cautious. You know a lot about the world, but you do need to be aware there are people out there who may look to take advantage. And, if it sounds too good to be true, it probably is. And check with friends and loved ones before you make a jump and make purchases of things that may not seem quite like what you normally would do.
Thank you, Christina. I want to thank our marvelous panelists, Dr. Dan Stone, James Darren, Christina Tusan, and I want to thank our partners at High Village for what a remarkable thing you've created with High Village, a community that didn't even exist a few years ago. You're helping people thrive every day. And our partners at LA Cityview Channel 35, thank you for enabling this to happen on live television today. As we look forward to a moment past the pandemic, let's commit to each other that we're all going to find a way, individually and collectively, for us to thrive into the future. Have a great afternoon. Good luck, everybody. Stay healthy and stay safe.